Good afternoon, everyone. Thanks for joining us for our media briefing today. We have limited time for some of our county staff, so we are going to start with questions and hopefully answers right away. And on the phone right now, we have Elsa Jimenez, our Health Department Director. She may be able to start with some of the questions about the process, and we're hoping other Health Department staff can join as well. So Elsa, are you on the call?
Hi, good afternoon. Yes, I am here. And then I also saw Dr. Ed Moreno has joined now.
Thanks very much. So I've got one question already in the chat, so we can kind of get started since I know our time is limited. Once the state posts the county's attestation document, how long will it take the health department to issue a revised shelter-in-place order that will allow dine-in restaurants and barbershops and hair salons to open?
So I'll let Dr. Moreno answer that since it is his health officer order, if that's okay.
Sure.
Hi, Mia.
Good afternoon, Dr. Moreno.
So so as soon as the state posts the attestation, the health officer order should be in effect.
And then another question on the attestation, as the county moves forward into the reopening process, is the health department weighing the risk factors of opening public swimming pools in the future? What are some of the risks with opening up public pools?
So public pools are not permitted at this time in stage 2 for public use. And the risk there is that it's a place where people from different households could gather and they wouldn't be able to swim with masks on. And there's high touch areas, the side of the pools, the slides. So that's one of the concerns about having people gather to swim.
And then another question, has the county begun working on the documents required by the state for stage 3? And if not, when would the health department begin that process? Again, this is assuming there is no surge from stage 2.5. When could we expect stage 3 businesses to be able to reopen?
So, I haven't seen any documents submitted or made available by the state for us to complete to enter into stage 3. And right now we're focusing on stage 2 because stage 2 isn't fully open at this point. So we'll continue to focus on stage 2 and then follow the metrics that were presented to the Board of Supervisors to see what the impact is.
Thank you.
And then may I add to that, if that's okay? So as Dr. Moreno indicated, right now the state is only allowing further advancement through stage 2 with the attestation process. But you could see where the state, based on review of the data statewide, is reviewing what industries are included in stage 3 and perhaps including them in part of early stage 2 or stage 2 with attestation, as we saw more recently with the addition of in-person religious services, and then more recently with the inclusion of barbershops and hair salons. So I don't know when the governor intends to advance or create a process for advancing through stage 3, but there could be additional sectors that are moved into stage 2 as we continue to reopen California.
Thank you. And then I have a question regarding data. Can you explain how the hospitals got to 298 daily testing capacity with numbers by hospitals?
Can you provide a little more information? I'm sorry.
You know, actually, I think the reporter means, can we explain how hospitals got to 298 testing capacity with numbers from the hospitals?
So if they're talking about, if the question is pertaining to the attestation, which I presume it is, we get information from the hospitals as to what their testing capacity is, and that's what we include in the attestation.
Right.
So if somebody wanted more information about a hospital's testing capacity, they should probably ask the hospitals for that information.
All right. Is the county health department working with the Monterey County Coroner's Office to test bodies at the morgue similar to Santa Cruz County?
So the coroner has in statute the ability to deem a death of an individual in the county as a potential threat to public health. And if the coroner just makes that determination, which is not a public health determination, if the coroner makes that determination, the coroner can decide whether or not to conduct an autopsy, which could include testing. The decision to test someone who dies in Monterey County for COVID-19 or any other tests is solely at the discretion of the coroner.
Thank you. And then when would you allow gun and archery ranges to reopen, since unlike golf, these sports inherently require social distancing and involve little, if any, shared equipment?
Mm-hmm. Okay, so that one I have to check. I'll have to continue to work with the state and determine whether or not where that might fall into stage 2.
Right. And then this is a follow-up question to the testing capacity data question that you just answered. Last week, we were 200 plus daily tests short of the daily capacity criteria for attestation. The gap seems to be made up in a matter of 24 to 48 hours before the preparation of the attestation document. Could there be some insight into how we made up the difference?
So I'm not sure that, maybe I'm not understanding but I'm not sure that that's correct. I think what the first version of attestation asked of counties was to show that they had testing volume. And the second version of attestation asked for testing capacity, which are related but different things. So the testing volume is how many people are actually getting tested. And the testing capacity is how many people could get tested per day. So once the second revised attestation was released and it focused just on the capacity for the indicator, then we met that capacity.
All right. Once stage 2.5 gets underway, what extra steps should members of the vulnerable populations take to protect themselves from a possible surge?
All right, so as we move from stage 1, which is essential services, to stage 2, which are lower risk services, and continue to move through stage 2, the state still has a stay home order, and I still have a shelter in place order. And the recommendation or the requirement is that people still stay home unless they have business that's permitted, and they can leave their homes to conduct business or participate in activities. And we still recognize, both the state health officer and I, that there are people who are more susceptible to COVID-19, and they're more at risk for developing complications, severe complications, and dying from COVID-19. So that population hasn't changed. The demographics still include people over the age of 65 and people with chronic medical conditions, and people who have compromised immune system, weakened immune systems. And then there's some other certain populations that may be at risk, such as homeless individuals who often have chronic medical conditions and other conditions that they're struggling with. So if a person falls into any of those categories, and they're at higher risk for severe complications and death from COVID-19, as we continue to release restrictions and allow reopening with modifications, those individuals still should be staying at home and only leaving when they need to. For example, if there's no way for them to get food, they may have to go to get grocery shopping. If they have an appointment with their physician and the physician says this appointment can't wait, then they need to go to that appointment. So that's still the recommendation out there.
Thank you. And then another question, a follow-up question on the data issue that we've had 2 questions on so far. So the county does not confirm or hasn't confirmed local hospital data testing capacity claims or numbers, nor how the capacity is broken out by hospital.
I guess I'm not understanding the question.
Does the county confirm the numbers provided by the hospital?
we rely on what the hospitals tell us. We don't go into a hospital laboratory to take inventory of their stock. We have a very good working relationship with the laboratories at each of our hospitals and the chief medical officers and support staff. And so we do rely on good working relationships, good communication, and availability of data that's provided to us to include in the attestation.
Thank you. And then as sectors reopen, how will business compliance with state guidelines be monitored and enforced? Will this fall to the health department or law enforcement agencies?
I'm sorry, can you read that one more time?
Sure. As sectors reopen, how will business compliance with state guidelines be monitored and enforced? Who would enforce them?
So very good question. Okay, so we have some businesses in Monterey County that are regulated. One example would be the Environmental Health Department's regulatory oversight over restaurants and other business, solid waste facilities, for example, any business that has large amounts of above ground or below ground storage of chemicals. So there's a variety of businesses out there that are regulated. And so what environmental health does is will do, actually what they've already done is as more activities and businesses were allowed to open with modifications, environmental health made an extra effort to spend an entire week going and visiting each business to go over what the new requirements are for resuming certain operations. So we expect that environmental health will continue to do that as we move through stage 2 and do that very important outreach, do that and perform that education, provide that education, and make sure that the businesses have and understand the local and state requirements for reopening and the modifications that must be made based on those requirements. And so that's one example. Another example would be that the cities could also provide some outreach and education to make sure that certain other businesses are complying with state and local requirements. So any city that has a license or permitting process has certain opportunities to assist in that type of oversight of businesses and activities to comply, to resume activities, but also do that with the required modifications so that visitors or guests or customers to the business have maintained a low risk of exposure from each other and from the employees, and likewise employees have a lower risk of exposure to customers and to each other. And then finally, I think it's I believe that that Monterey County residents to some degree do a little bit of enforcement on their own, making polite comments to one another, suggestions to one another when we're out in public, to remind each other of the importance of social distancing and covering our faces while we are out there.
Thank you, Dr. Moreno. I have no other questions in chat. No, never mind. I have one more. How many people have been asked to self-quarantine at this time due to exposure to someone who has COVID-19? Are there any reported clusters in this county?
So I'd have to get back with you on that. And if you have the name of the person who asked, I can get that information. I apologize, I haven't looked in a while. It's been probably a week since I last had that information, or over a week since I met with this group. But it was back then. It was probably it was at least 1,700, but I'm sure it is more than that now. And then the other question, there was another part of that, I'm sorry.
Sure. Are there any reported clusters in the county?
So there are clusters. Thanks for the question. So we find that as we interview people who are diagnosed with COVID-19, we find that the contacts that they have are often people that they know or are familiar with and had recently met in groups. And so we have seen clusters from weekend events. For example, there were clusters related to larger Mother's Day gatherings. And as a result of one person showing up to a Mother's Day gathering infectious, other people were exposed and other people became infected as well. So there are clusters out there. So there is still a very good reason for us to stay at home and not gather with people outside of our households, because these are friends and families who are infecting each other, and the virus doesn't care if you know someone or you're related to them. If you're infectious and someone's susceptible, there's a good chance that if you spend at least 15 minutes with someone and you're within 6 feet of them, that you've exposed that person, they can come down with COVID-19.
Thank you. And on another topic, the data reporting system on the county website has changed, or the health department website has changed. Can you explain why the changes, and is the new site compatible with mobile devices? We've heard from from readers telling us they cannot access the new data from their smartphones.
So yeah, sure. So thanks. So we have regular meetings with our bosses, the county supervisors, and with IT to be responsive to the public's request for data. And so the changes that we've recently made were in response to the public's request. In terms of the accessing on the app, our IT director for the health department shared with us that the new display that you'll find on our website when you use your mobile device has at the bottom a tab or a button that you can press, and it'll take you to the full site version. So as it was explained to us, the provider of this data representative service knows or recognizes that people have different types of mobile devices, and so it can't predict what your mobile device is going to do. So, or what the mobile device you have. So it you can see the data, and once you're at the site and looking at the data, then you can push the button at the bottom of the screen, and that information will tell the server what type of device you have, and then you can get full access and better access to accessibility to all the data on your mobile device.
So I have another question related to the new data display. You kind of answered it before, but I'm going to morph this question with some other questions we've had from the public. Did the county actually get rid of the data tables it had been using, or are those still available?
So we haven't deleted any of the data that we have here in the health department. We've only displayed it differently. And so we'll continue to work with our county supervisors and our IT director to listen to what the public is asking for, and try to continue to be responsive to requests of the public to make data available in a manner that they feel is useful to them.
And then may I chime in
Please.
as well? So the process that we were using previously was very manual and required a lot of staff time to be able to put those tables together. And there was a request in terms of, using a tool that would display data similarly to some of the counties around us, like Santa Cruz, Santa Clara, using a tool called Power BI. And so that is a much more efficient process in terms of being able to quickly display data. And like Dr. Moreno said, the data is all still there, but the actual production of tables, that aspect of it has gone away as we've transitioned to the Power BI tool. As I mentioned, that was a manual process, and our intent was to be able to move to a more automated process more quickly, with the ability to be able to more quickly present the data.
Thank you, Elsa. And then Dr. Moreno, a follow-up question to your discussion about clusters. How many people were infected from the Mother's Day event that you mentioned? Where did that occur?
Good question, but I can't provide any information on that cluster because of HIPAA rules, and we need to maintain the privacy of the individuals that were unfortunately infected in that cluster.
And then another question, a follow-up question on pools that we talked about earlier. Is Monterey County the only county not opening community pools at this time?
All right, so I haven't checked with other local health officers from other counties recently, so I don't know if what other counties are or are not allowing public pools to be open.
Thank you. And then I have no other questions in chat right now. Is there anyone who, as soon as I say it, one comes in. Just a follow up on the Mother's Day cluster. Did that cluster occur in Monterey County? Because I think there's a question, which county did it occur in?
Oh yeah, okay, yeah, sure. So our health department only has jurisdiction for residents in Monterey County. And so, yeah, so when we're investigating and we're contacting a lot of these cases, most of these cases are in Monterey County. But there are incidents where people live in another county and travel. And so if that happens, we would know about someone who participated in a gathering like that. But if they're from a different county, then we have systems in place where we work with the health department of the county where that person resides to follow up on that person.
Thank you. Is there anyone on the line? Oh, go ahead, Elsa.
Maya, could we go back? So Dr.
Sure.
Moreno, in the chat, I put the capacity of testing that we presented at our Board of Supervisors on May 19th, and then yesterday, how the number has not changed, which is 682. But there's still a question about perhaps prior reporting in terms of the hospital capacity. Could the difference have been because of the fact that our hospitals now have instruments in-house that allow them to process rapid tests at a greater volume and at a greater return for results? Could that be one reason? And I don't know, Jim, if maybe Jim or Sarah could explain how long ago it was that we were reporting a lower testing capacity in the county. I mean, it could be that since then the hospitals have acquired new instruments that is allowing them to increase their testing capacity per day.
So Elsa, yeah, that could be part of it. It really depends on when we reported capacity or volume. So if we were reporting volume, the volume will always be lower than the capacity to test. But with regards to capacity itself, we had, I think in the last, I guess 2 weeks now, Optum and, well, the 2 Optum sites opening up. And we've also had, in the last 2 weeks, we've had hospitals acquire additional equipment and also acquire the testing reagents necessary to test. So the capacity has gone up, and as a result of primarily of Optum increasing capacity here in Monterey County, our volume also went up as well significantly. So about the time as we were putting this together, I think we had 3 or 4 really good days where the volume went up significantly, and people were the 2 Optum sites can treat or test, or excuse me, collect specimens for up to 132 people a day, and we jumped up into the 110s, 120s, close to 130 every day at both sites for about 4 days. So our capacity had gone up and our volume had gone up significantly after more outreach was out there to encourage people to go get tested.
Hey, Maya.
Yes.
Yeah, it's Jim Johnson with the Herald. I'd just like to explain sort of the background of my question. I've been asking the hospitals, CHOMP, Salinas Valley Memorial, and Natividad about their daily testing capacity for a while now. And only Natividad has said they could test more than about 20 people max capacity. Natividad is claiming 190 daily testing capacity. So the 20 sounds more realistic. The 190 sounds ambitious. So I'm trying to figure out, where, even with the 220s and the 190, they're still short by a bit. I haven't asked Mamie Memorial, but I'm just trying to figure out, how the hospitals reached the 298, because the other daily testing capacity seems, like it's been reported fairly consistently. But the hospitals is, for me at least, is kind of still a mystery. Thank you.
So Dr. Moreno or Elsa, do you want to address that, or is that a question for the hospitals?
So you described what's concerning or puzzling you. I didn't hear a question, but what I can do is go back and check with my team again on the testing capacity and how we arrived at those numbers to submit to the state.
That would be great. I just, at a minimum, unless the hospitals all submitted a daily testing capacity in one block, at the 298 figure, it seems like County Health would be able to determine which hospitals could test what amount on a daily basis. Now, I realize there's a big difference between volume and capacity. But still it just feels like there's a gap there that I'm not understanding. Can I assume that the hospitals each reported to County Health what their individual daily testing capacity was?
So I wouldn't want you to assume. I'd prefer to go back and check and get back to this group.
Thank you. I appreciate it.
Mm-hmm. Sure.
And then I've got a question that I believe relates to the data, although it's coming out of the daily situation report. On page 5 of the situation report, the table that lists cases by geography, each city has several colors in the table, and there's no explanation on the colors. What do they mean? And I think those color bars, if you hover over them, you get the region or the zip code. Is that correct?
This is Elsa. Excuse me. Yes, that is correct. But unless the daily situation report is a link to our website, then it's really just a static copy of a table, which as a standalone means nothing. Because as you indicated, when you go onto our data website or webpage on the Health Department COVID-19 website, hovering over the different colors gives you the data elements in terms of the volume. And, subsequent to that, I think yesterday is when we started to post the actual table beneath the charts on our Health Department website, that then, if you click on a specific section, it'll give you the zip code for that color and then the incident cases. So that's been a modification that we've implemented at the request of the public with respect to being able to more easily see what the figures were in each of the different color sections. But if Kelsey is just copying and pasting an image off of our website and putting on the daily situation report without the associated table, then it would be really hard to decipher what those colors mean.
And that's something that I can follow up with OES, which produces the daily situation report. Thanks for that question. And then here's a question about the sports center in Monterey. The city of Monterey is discussing reopening the sports center and its pool by appointment for social distancing during stage 3. Would by appointment pool usage be an acceptable way to open public pools?
So moving forward, the county is going to be aligning more and more with the state. And so we'll be looking we'll be actually probably working with the state health officer to make recommendations for what, how pools and other public recreation activities, what requirements would be issued by the state. Ultimately, it's the state will come up with something that they will put out as the state requirements, but I'm hoping that local health officers and health directors will have some input on that, because we have had some input and many of some of the requirements and guidelines that have come up from the state. But that's in stage 3, and I think it's it's a very good idea for businesses, government and businesses who have activities that are currently identified as stage 3 to start thinking about now how they might open following the social distancing, because making plans now would allow those businesses and governments to be better situated in terms of beginning to plan ahead, begin some education to employees, and also to think about what type of supplies that they would need to reopen, such as cleaning materials, disinfectant, things that you already see out there now, tape on sidewalks leading into some stores and at cash registers, so they can start, they should be planning ahead so that when the requirements come out and those businesses can resume operations with modifications, they'll be hopefully ready to go.
Thank you, Dr. Moreno. And I know Elsa dropped off the call because she was limited until 12. She was only available till 12:30. Are there any other questions for Dr. Moreno? If not, then that will end our media briefing for today. Thanks for joining us. Our next briefing will be on Friday.
All right, thanks, ma'am.